Hello everyone, welcome to Healthy Hub channel. Today, we'll be discussing an incredibly important and often sensitive topic, miscarriage. Miscarriage, or pregnancy loss, affects millions of people and families worldwide, yet it remains a topic that's difficult to talk about. In this video, I'll break down exactly what miscarriage is, what causes it, the signs and symptoms, how it's diagnosed, and what treatment options exist. Whether you're looking for information for yourself, to support a loved one, or just to understand more, this video aims to provide a compassionate, informative overview. Let's begin. What is a miscarriage? A miscarriage, or spontaneous abortion, is the loss of a pregnancy before the 20th week. Most miscarriages happen within the first trimester before the 12th week, but they can also occur in the second trimester. Miscarriages are surprisingly common. Experts estimate that about 10 to 20% of known pregnancies end in miscarriage. However, the actual number is likely higher since many miscarriages happen before a person even realizes they're pregnant. Causes of miscarriage. There are multiple factors that can lead to a miscarriage, and in most cases, it's challenging to pinpoint an exact cause. Some common causes include: number 1, genetic and chromosomal issues. Many miscarriages result from chromosomal abnormalities that prevent the fetus from developing properly. Chromosomal abnormalities can happen due to random errors in cell division, leading to conditions incompatible with life. This is the most common cause of first trimester miscarriage. Number 2, maternal health conditions. Conditions like diabetes, thyroid disease, or autoimmune diseases may increase miscarriage risk if not properly managed. Hormonal imbalances or autoimmune responses can interfere with the pregnancy, leading to pregnancy loss. Number 3, infections. Certain infections like listeria, cytomegalovirus, and toxoplasmosis can raise the risk of miscarriage. These infections can affect fetal development or cause complications that result in pregnancy loss. Number 4, anatomical factors. Structural issues with the uterus or cervix can sometimes cause miscarriage. An abnormally shaped uterus, fibroids, or an incompetent cervix, one that opens prematurely, can lead to miscarriage, particularly in the second trimester. Number 5, lifestyle and environmental factors. Excessive smoking, alcohol use, substance abuse, and even high levels of stress can impact pregnancy. Exposure to certain chemicals or environmental toxins, like heavy metals, has also been associated with a higher miscarriage risk. 6, advanced maternal age. As age increases, so does the risk of chromosomal abnormalities. Women over 35 have a higher risk of miscarriage than younger women, likely due to age-related genetic factors in egg cells. Signs and symptoms of a miscarriage. Recognizing the early signs of a miscarriage can be challenging, as symptoms vary widely. Common signs include: 1, vaginal bleeding. Light spotting or heavy bleeding is often the first sign of a miscarriage. However, some bleeding during early pregnancy is normal and not always a sign of miscarriage. 2, abdominal cramps and pain. Cramps or a sharp, persistent pain in the lower abdomen may accompany bleeding. Pain can vary from mild to severe. 3, loss of pregnancy symptoms. Sudden loss of symptoms like morning sickness, breast tenderness, and fatigue can indicate a miscarriage, though this doesn't always mean pregnancy loss. 4, passing tissue or clots. During a miscarriage, the body may expel tissue or blood clots, often accompanied by heavy bleeding and cramping. 5, back pain. Severe, persistent back pain is another sign, especially if it's lower back pain that wasn't present before. Diagnosis of miscarriage. Diagnosing a miscarriage usually involves a combination of physical exams, blood tests, and imaging. The first one is ultrasound. An ultrasound is one of the most reliable methods for diagnosing a miscarriage. Doctors look for signs of fetal heartbeat and development progress, especially if there's heavy bleeding or cramping. 2, blood tests. Blood tests are used to measure human chorionic gonadotropin, HCG, levels, a hormone produced during pregnancy. If levels aren't rising as expected, it could indicate a miscarriage. 3. Pelvic examination. A pelvic exam allows doctors to check for signs of an open cervix or tissue passing, both potential indicators of a miscarriage. 4. Genetic testing. In some cases, if a person experiences recurrent miscarriages, genetic testing of both partners may be recommended to identify potential chromosomal issues. Treatment options for miscarriage. The treatment approach depends on the type of miscarriage and the individual's physical and emotional needs. Number 1. Expectant management. In some cases, especially early miscarriages, the body will naturally pass the pregnancy tissue on its own without intervention. Doctors may monitor the situation to ensure everything passes safely. 2. Medications. Medications can help speed up the process of tissue expulsion, allowing the body to pass the pregnancy more quickly. This can be done at home, but under medical guidance. 3. Surgical treatment. A procedure called dilation and curettage, DNC, may be performed to remove pregnancy tissue from the uterus. This is often recommended if there's a risk of infection or complications. 4. Emotional and psychological support. Miscarriage can have a profound emotional impact, and counseling or support groups can offer significant relief. Many people find talking about their experiences or joining support groups beneficial for mental health. If you found this video helpful or supportive, please give it a thumbs up and consider subscribing to our channel for more health and wellness content. Share this video to spread awareness and understanding about miscarriage. And remember, if you or someone you know is dealing with this experience, support is available. You are not alone. Comment below if there are any other topics you'd like us to cover. Thank you for watching and for being part of this important conversation. Miscarriage is a deeply personal experience, and understanding it better is one way to offer support to those affected. Remember, if you're navigating this journey, allow yourself grace and reach out for support when you need it. Knowledge and community can be powerful forms of healing. We'll see you in the next video. Take care of yourself and stay informed.